Today's subject is Health Education and Community Pharmacy. We are in the chapter number 4, that is first aid. In this lecture, we are going to see the first aid treatment for shock. Then we are going to see about the shock. Shock, in the medical term, shock is a condition which occurs due to the loss of circulating blood volume. It is called as shock. The shock is a term which is often used loosely, resulting in the confusion. Then, in the medical term, the shock is a condition which occurs due to the loss of circulating blood volume. Means blood का loss होना due to the rupture or injury of the blood vessel. तो shock in the medical term, it is occurs due to the loss of circulating blood volume due to the ruptured blood vessel. Blood का loss होना, इसकी वजह से shock हो सकता है. Then we have to see the causes of shock. Shock कैसे होता है? The cause of shock may be classified as follows. The first is loss of circulating volume. The reasons are, the first is hemorrhage. ठीक है? Loss of circulating volume means blood का loss होना due to the hemorrhage. Hemorrhage means escape of blood volume from the ruptured blood vessel. Then second, due to burn. Second, due to the prolonged vomiting or diarrhea, it is one of the symptoms. Cause. Third is the burn, and fourth is the peritonitis. The peritonitis means inflammation of the membrane. It is a leakage or hole in the intestine called as the bursting or appendix. Then loss can be occurs. Then second is increased circulatory capacity. The cause are certain types of fainting, means unconscious or not. Then severe infection. The third is pain and fever, and fourth is overdose of the drugs. These are the causes of increased circulatory capacity. Then third is lack of normal circulation. The cause are, the first is heart attack. In this, blockage can occur in the coronary artery and blood cannot be flow in the normal condition. Second is abnormal heart rhythm. Then third is massive pulmonary embolus. Embolus means a clot. Then what is the sign and symptoms of the shock? The first is anxiety. Anxiety means the nervousness and restlessness. It gradually progresses to the loss of consciousness and coma. Then second sign and symptom is nausea and vomiting. Then third is pallor. Pallor means pale color of the skin. It is called as pallor, and sweating. Then fourth is the fast and weak pulse. Means pulse can be irregular. Then fifth is rapid and shallow respiration. Then heart and respiration becomes irregular and stop. Means the respiration can be irregular in this condition. Then next you have to see the treatment of shock in first aid treatment. First is the reassurance. The time to time reassurance is given to the patient कि he is recovered as early as possible. Then second, the patient is laid down with raised legs. It is called as the recovery position, in which body posture can be adjusted to the recovery position. In this, the patient is laid down with the raised legs. If there is vomiting, this is important. If in this condition there is vomiting, or if there is interference with the breathing, then in this condition the patient is placed in the 3/4 prone position. This is important. This position, 3/4 prone position, is called as the recovery position. This is important in the first aid treatment. If vomiting or breathing is irregular or interference in this condition. Then third is the clothes around the neck, chest and waist are loosened for the proper breathing. Then fourth is the patient covered with the blanket or rug to prevent the shivering or cold conditions. The rug means a thick woven of the cloth. Then next is, if any associated injury is treated, is possible. If any injury occurs with the shock, if it is possible, it is treated. And next is, nothing is given by the mouth, and smoking should not be allowed. Then in this shock condition, nothing can be given by the oral route, that is mouth, and smoking should not be allowed. And 7, expert help is summoned. Summoned means to call for the expert help. And further step to be taken in the shock, the patient should be after expert help is summoned, the patient should be admitted in the hospital as early as possible to give the further treatment. Then in this lecture, we have to see about the first treatment of shock. What is shock? Shock means the loss of circulatory blood volume. Then we have to see causes of shock. Then what is signs and symptoms, and last is the treatment of shock.